Welcome to the office.
Hi, Mohammed.
Hi.
Welcome to the office. How can I help you?
Oh,
What are you doing here?
I came all the way from Germany to get sorted with my problem for my life.
Okay. So right now you're currently in Germany.
Yes.
You have a few things going on.
Oh, yeah.
What's going on?
The major part would be I have continuous issues on my lower back,
Okay.
which buzzing through my legs, down to my legs, especially at the right
Like
side.
a sciatica?
Kind of sciatica, because I don't know what exactly sciatica is.
Okay.
It's
Shooting pain down the leg?
down the leg, sometimes stop at knees, but sometimes
Excuse
it goes onto the foot.
Okay.
It's
And it goes into the toes?
toes on the out part, so like not the inner but outside get more affected,
Okay.
which is interesting. I don't know why.
That's okay. On the small toe?
Mainly small toe, yeah.
You got it. Okay. And that's been going on for how many years?
It started to appear about more obviously 7 or 8 years ago.
7, 8 years ago. Did you have a trauma? A slip, a fall, an accident?
If it's according to my lower back, then I would say when I was in elementary school, probably when I fall off the tree.
Okay. Alright.
Yeah,
So-
I fall on the hips.
You were active, right?
Oh, I was very active.
Very active. Okay. All right. So number one is low back pain, with shooting pain down the right leg,
Yes.
goes into the ankle, sometimes into the foot.
Yes.
Right. Been happening for 7, 8 years.
Exactly.
On it. Okay. And it's been constant.
It is always there, but the intensive will be changing.
Okay.
Every now and then gets really strong, where
Okay.
I'll be just like giving up everything, lie on the bed, and don't bother doing
You can't do
anything.
nothing.
I can do, but I don't want to because I get really tired.
Understood. Number two,
Number 2 will be my neck.
your neck. What happened?
That would be my case when I was like 3 or 4 years old.
Okay.
We were in an amusement park,
Okay.
and you know those go-kart where the people hit each other.
Yeah. Bumper cars.
Yeah, bumper cars.
Yeah,
That's
okay.
exactly what happened. Of course, got crashed from every single side. I end up bumping my face towards the front part. I bled quite a lot on my front teeth.
Okay.
And after that, I will be like sleeping way too deep, like where I have really problem to wake up every morning.
Because you're tired.
I'm very tired.
Is there any shooting pain into your arms?
There are on the back side of until my elbow,
Okay.
and also I have like shoulder kind of bit not even leveled. The
Okay.
right side's a bit higher, so I can raise them. That's not okay. That's okay. I don't have problem with that.
Yeah.
But I have like not enough strength on the right side. I have enough strength on the left side compared to the right.
So we have a weakness on the right arm.
Yes.
Okay.
But on the left arm, I have a bit trouble to raise up. I can raise, but not for a long time. Then because the pain starts to shoot off.
But you're not getting the shooting pain on the right side.
No.
Got it. Okay. Do you have weakness with pain on this side or just weakness?
Also pain, yes. But it's different kind of.
What does that mean?
This one, it's more kind of muscular pain, whereas
Okay.
this one is more like nerval. I don't know if I can explain it any better than that.
That's fine. That's okay.
It's a bit hard for me.
That's okay.
If I can add any other information.
Please.
When I sleep on the left hand side, which is I'm more side sleep,
Yeah.
then I have less issue on my lower back.
Correct.
But I have issue on my neck.
Correct.
And if I sleep on the right side, then it's
Your
the other
lower
way
back,
around.
Yeah. So you need to sleep on your back.
Yeah, but then still I have pain going on.
Well, we're gonna fix that. Okay.
Yeah.
All right, we'll fix that. Number 3.
Number 3, I also have every now and then bit problem with breathing.
Okay. Shortness of breath,
Yes.
anxiety, or no?
Anxiety not, but if I add to the neck problem, I have also spacing out in between when I'm talking with somebody. Like they be telling me a story, but I'm not catching up all the way.
What were you saying? Sorry.
That's the one.
I was being funny. Sorry. Okay.
Yeah, but it's similar.
Okay. So you just kind of lose focus.
Exactly.
All right. So this is going to be an interesting case. Let's see where it takes us. Come on over. On the side profile, the first thing we want to talk about is your curvature. And when we're looking at it, we want to see, do we have the right curve, 60-degree reciprocating curves?
Mm-hmm.
It looks like you have a good curve in the back here, but we actually need a little more curve in the low back.
Okay.
You swing back.
Oh.
Okay? You swing back in terms of, as opposed to curving back. Now, if we run the posture line from the center here, and we can see this is not so bad. So you do compensate very well in terms of what? Your ear lines up with your hips or your L5.
All right.
Your base of your neck or shoulders is slightly behind, and being slightly behind can contribute to a little more muscular activity up here in the shoulder area.
Okay.
We're going to come back to this x-ray, okay? Let's go into the AP right away. And let's see what are some of the things that we see here. We do see that there's a little bit of a kink right here, right?
Mm-hmm.
In terms of whether that was trauma, posture, probably the traumas. Now, before we get there, we need to go lower. And you said if you sleep on your right side, your low back hurts.
Yes.
Now, here's what's misleading, and I'm glad we said that because you just gave me a piece of the puzzle that I wouldn't have seen otherwise. So this is good information, guys, and this is from the history. We talk about the high side of the rainbow, right? And depending on which way the spine curves, that's the way we want to sleep high side. So when we look at the overall appearance of your spine, it's curving which way in the low back? It curves this way. So the global appearance of the lumbar spine, it has the concavity on the right, the convexity on the left. So theoretically, you should feel better sleeping on your right side in your low back, but you don't.
Nope.
So now we got to go closer and see why, and then we get the answer. And the reason why is this, because it's curving this way, we said, right?
Yeah.
But in reality, it's wedging on the
right side.
So this is going to be an interesting case to figure out, dude, because you don't follow the normal pattern. Okay? Now, we have to look at your foundation, and we have to see, do we have a level base and foundation? And let's go to the numbers, and there's a piece of the answer. And this is actually interesting, because you have a EX pelvis on the left, okay? I'll explain all of this. You have a rotated pelvis on the left, rotated sacrum on the right, but you have a drop of 4 millimeters on the left, on the side of the open SI joint. So let's put this together. The left side opens EX. The sacrum on this side goes back a little and drops down. So that's the disconnect in the walk. So I'm pretty sure you got the wiggle going. I'm pretty sure. Now, if we find that the left SI joint is fixated, we work on the pelvis. If we find the right is fixated, we're going to figure out which one we're going to work on. Okay. What do I mean by that? I probably am going to start lower in the tailbone, not on the rotated right sacrum. Right. I want to bring this left side up some. And this is we're going to figure it out. It's going to be a little challenging because we have an EX on the drop side. So like we want to torque it up and then close the SI joint. We got to figure out what your body's going to be able to take. Now, as a result of whatever these traumas were in the back, now let's look closer here. So we have a drop on the left side, we said, right? Okay. Let's go to the side profile and let's look at your tailbone and let's see, what do we see? And you had a few injuries, actually. Oh. So this should be a smooth curve arc. You can see one nub, two nubs. Oh. So we don't really have the curved sacrum the way we want, and that's okay. It can be a little flatter, but because of that, the way it's formed, it's contributing to that short leg, okay? So what we're going to do, we are going to probably start somewhere down here, S3, S4. Okay? Now, we'll come back to that in a second. All right, let's work our way up. So once we sort out your foundation, we work on your L5. L5 is a special listing called a PRS-M, posterior right, superior in the concavity. So the adjustment of that is going to be on that side. Okay, let's continue up. As we follow it up, now, question is what happened here? We have to look a little closer because this is the area that controls your digestion, dude. This kink, you can see this kink. Now, what's interesting in your kink here, Mohammed, it kinks to the right, but then it kinks to the left.
Oh.
And then it goes to the right again.
Yes.
Okay?
Oh, kind of zigzag.
So it's got the S shape. And a lot of this is compensation coming, number one, from low back. Number two, whatever we're finding in here around the digestive area. We also have a T2 potential or T3 side slip.
Ooh.
And it means there was some trauma right to left side. For that, it's a little bit of a spicy adjustment. Your upper cervical is all compensation, dude. Your neck is all compensating.
Also for the penthouse?
Yeah, but even before the penthouse, this whole part of your spine is compensating.
Oh my.
And it's coming from here, which is coming from here, which is coming from here.
Down low.
Yes, sir. Let's go to the side. Now, let's look at your profile. And we said we have the tailbone issue. Your discs are great, by the way.
Oh.
Your low back discs. We will need to deal with your L5 once we sort out your foundation because that's starting to pinch at the back there. Okay, so those ligaments are going to shorten in that position. We don't want that.
Okay.
Your neck is almost textbook perfect here.
Ooh.
Hold on, never mind. Something is missing up top. His atlas is hiding way up top there.
Oh.
These discs are all textbook. This curve is good. We want to see, all right, this is neutral. So he doesn't have a lot of extension. His extension is at his muscles, but not his bones.
Okay.
You have an upper cervical issue from your fall. Okay, there it is. So let's look at this. And what do we see? We see the upper cervical here. This atlas is hiding inside there, okay, like that.
Oh.
It's hiding in there.
Oh my.
And look, I can't see the posterior arch. It's touching somewhere. In extension, yes, but in flexion, I should see it. I don't see it.
Oh.
It's right there hiding.
Sure.
So there's something in the the penthouse.
Okay.
So we have the penthouse, we have the basement.
Right.
We have some stuff in between too.
Okay.
If we have to figure out where we're going to start, probably the penthouse and the basement. Probably. But let's see.
Okay.
That kind of threw me off. That was good. He doesn't look so bad from far, but when you get closer, you got all these little things hiding out there. Okay. Are we clear on this, sir?
Yes.
Okay, so why don't we get started? Stand up for me, please. All right, let's walk it out. He got the Tokyo tinkle. It's not bad. It's not a bad wiggle. It's just a little tinkle.
Okay.
You see the difference, Shasha? It's the Tokyo tinkle. He's very rigid in his walk. You're very stiff when you walk.
I thought so, yeah.
Yes. Keep going,
I
please.
do get quite stiffness. In my
Are you
legs.
getting the shooting pain right now down your leg?
Right now it's okay. It's just when I sit more, mainly it start to appear more than walking. But then of course if I walk for a long time, then it will start off.
Right. So he pronates. Keep going. There's a drop or a collapsed arch on the right side. His arch is collapsed on the right. His left arch is decent. Okay. So that right arch, he had a bad right sprain. He had a bad right sprain. Okay. Keep walking, please. It's kind of cool when you can help people discover their injuries or even when they don't tell you. Have a seat, sir. Let's get started. Starting at the base of the neck. 15 points. C6, C7, left side. C1, 20 points, 21 points. Left side. Let's get a little bit closer. Doo-doo. Doo-doo. There it is. Down in the basement. 10 points, S4, S5.
Oh, interesting.
C6, C7, C1, S4, S5. Those are the three majors I'm finding today, okay, sir?
Okay.
Let's start by checking your hips, feet together, open and close, slide forward. We're looking at general movement of the SI joints. Go ahead, open and close. And you can watch my thumbs. There you go, right side only. And when he does the right, a tiny little bit of movement on the left, but not bad. Okay, so when he does the left, the right is fine. Now you feel the difference. Do the right side. Okay. You see that?
Yeah.
You have more movement on the right.
But left is just stuck.
Yes. Scoot back for me, please. And let's check the L5 sacrum. Back slowly in extension. Okay. That's 5.
Okay.
That's 1. That's 2.
Ooh.
That's 3.
Ooh.
That's 4. Not bad.
No, not that.
5. 4 is okay. 3. Yes?
Yeah, 3 is the strongest so far.
This is 5. This is 1. This is 2. This is 3. 3. Let's do static palpation. I just want to get an overall appearance of what's going on here. So we're probably going to get this area show up later. You can see there is swelling here. And you can see the bumps disappear in here. But that's not the major today, okay?
Okay.
We've got to go through the layers. Let's go to your neck and let's check the neck. 7, 6, 5. Try different angles. Go side, go left, go right. 6, 5, 4, 3. Oi. Ah!
Oh!
Ah. Wow. Head down. That atlas though is so riding up there so hard, dude. It's AS severe. We gotta really torque that atlas down, dude.
Oh, wow.
Okay, I won't go harder than that. Turn to the left, turn to the right. It's restricted on the left more than the right. Look up, isolating the lower cervical. That's restricted there.
Yeah.
Let's look down. They're both restricted.
All the way.
Damn, he's gonna make me work. I'm going with the top. Penthouse in the basement.
Wow. As you're pushing for the top,
Yes.
my left tooth starts hurt.
Ah, interesting.
Yeah, the upper tooth. Oh. It's like comes shooting off.
Look, right side,
Yeah.
C2 left, C2 right. C1 left, C1 right. Occiput, let's check the nodding. Sit back, sir. And let's just check nodding. Good.
Oh.
You ready for me?
Yes.
All right. Now, what I'm going to do, we're going to do S3, we said.
Yeah.
S3, we're going to set it with the torque slightly up.
Okay.
And for your upper cervical, what are we going to do here? Damn, he's going to make me work. It's actually misleading, dude.
Yeah.
I'm tripping out a little bit on this. It's actually misleading because it's C2 on the left, C1 on the right, and occiput on the left.
Oh.
That's really... This is a critical everything. Normally I talk about a critical atlas. So his C2 is wedged on the left. His C1 is wedged on the Right. That's your atlas. But then he's got the opposite wedge of the occiput. That's a first.
Oh my.
So I wanted to start on your upper cervical. No.
Oh.
I'm going to start on your foundation,
Okay.
on your sacrum, S3.
Right.
We're going to go there. After that, we're going to have you walk. I'm going to recheck. Something's going to shift.
Okay.
Okay? You ready for me?
Yes.
Slide up. Good. Palms up and receive. S3. S3. Relax the shoulders. And that's the home run, baby.
Whoa. That was nice.
Very nice.
Oh, I could feel something move, like my whole leg also. Like, as if it all shifted down. Oh.
Oh.
Ah.
Oh.
I kind of feel also a bit taller though.
Ah. Walk it up.
Ah.
Let me open the back of your gown.
Oh yeah.
Thank you. Let's see if there's any more tinkle. Walk it out. A little bit better.
Mm.
A little bit better. One more time, please. Very nice.
Oh, I can
Good?
feel the difference, yeah.
Have a seat. Let's rescope. Let's see what shifted. How's your sitting?
Yeah, much better actually.
Head down, sir. Starting at the base. That cleared his neck.
Oh.
And now it went to the right side. That's crazy.
Wow.
So remember I said it went C2 left, atlas right, occiput left. So now I can justify the right atlas. I couldn't justify it. All right, head down, please. 6, 5, 4, 3, 2. I got to start here, brother.
Mm. Oh.
Okay.
Okay.
2. So I'm gonna do the C2 left. C2 left, C1 right.
Okay.
Okay, let's do it. This is for C2. Nice and easy there. Try not to help. That's a baby. Little more. There's a little more. Switch hands. Now let's see what we can get here. C1. ASR. That's a nice angle. So that elbow needs to come down more. ASRA. So we need to come AS to get rid of that AS. We got to torque down this way. ASRA. So I got to bring, instead of being here, we got to turn the head there, bring the elbow down, and that's the home run.
Oh. Oh. Didn't hurt that much though. Actually, didn't hurt at all.
Yeah, it's not supposed to.
Ah.
Deep breathing, sir. Check it out. Deep breathing. Deep breathing. You sit up straight. Little different.
I feel a bit warmer.
Head down, please. Let's recheck. All clear. Neck is clear.
Nice.
Your lower neck cleared up as well.
Interesting.
Interesting what?
Even though you didn't touch it. Of course, it's more smoky.
Back, check it out.
Ooh.
Check it out.
Wow.
Hi.
Hi. Oh.
Hi.
Wow. I think I got more flexibility now.
Look. Look.
Nice.
Look.
Oh.
Sit back, sir.
Oh, nice.
Ears.
Oh, nice.
Right shoulder. Left shoulder. That's it. All of that is compensating. All of your stuff is compensating. Look to the left. Look to the right. Look up, left. Different.
It is a bit different. Though.
Still a little tight, but
Yeah.
different.
Yeah,
Head
it is.
down.
Ah, that's a huge difference. Nice.
Nice. Let's go on your back over here. Let me do your ankles.
Yes.
So on one of my cases, I pulled the ankle. I think it was the lady that came from Mexico City, the gymnast. And after her low back adjustment, I pulled her ankle. And I asked the question, right? And people were wondering, like, why did I pull it? Because normally I'll use the board.
Yeah.
She had good stability in her hips.
Okay.
Okay, and the way I was setting the ankle, I actually didn't pull it. I scooped it down.
Okay.
So it was a very different adjustment. And she needed that because there was more AS. So we're scooping to close that gap. And so when it goes anterior superior. So more of that superior component, we're scooping it down in order to get rid of that superior component. Relax there. Tender. Tender.
Ooh.
Both tender.
Yes. Whoa.
AS talus. AS talus. Stand up and walk it off one last time. As you're walking, let me know if you have any questions, sir.
Is it also like my back was affecting me from feeling a bit colder than usual? Kind of?
You mean there is the calorific center in the spine. What is calorific center?
Okay.
Calorific is the temperature control of the body. Calorific center is in here. Okay?
Because I used to get like feel really colder.
Your walk is changing already. It's good. A little less tinkle.
Tinkle.
Let's check your hands, sir. Squeeze. Hands good. Squeeze.
Maybe left hand's not bad.
Just a little bit on the elbow. Elbow.
Ooh. Wow. Oh.
Ah!
Nice.
A little bit still here.
Oh.
All good. Squeeze. We're all set for today, sir.
Thank you.
Welcome to the office.
Thank you very much. Oh, I love it.